Welcome back to my channel. Today we are going to study a very simple and a very important topic, that is the nerve supply of the tongue. It is a very frequently asked topic in examinations. So let's get started. Tongue has two supply, that is a motor and a sensory supply. Sensory supply is further divided into general sensation and taste sensation. The taste receptors comes under taste sensation, and pain, temperature and all comes under the general sensation. Okay, so first we'll study the motor supply. All the intrinsic and extrinsic muscles are supplied by hypoglossal nerve, that is the 12th cranial nerve, except the palatoglossus muscle, which is by the cranial root of accessory nerve, that is a vago accessory complex from the pharyngeal plexus. Okay, I have made a very simplified video on intrinsic and extrinsic muscles of the tongue. The link is in the description below. You can check the video later onwards. Okay, so let's continue. The sensory supply is the tongue is divided into three parts: anterior 2/3, posterior 1/3, and the posterior most part. So anterior 2/3, the general sensation, that is the pain and temperature, are by the lingual nerve, which is a branch of V3, that is the mandibular division of the trigeminal nerve, which is the 5th cranial nerve. Okay, taste is by the cauda tympani, that is a branch of the facial nerve, which is the 7th cranial nerve. Now the posterior 1/3 along with circumvallate papilla, both the general and taste sensations are by the glossopharyngeal nerve, which is the 9th cranial nerve. And the posterior most part is by the internal laryngeal branch of the vagus nerve, that is the 10th cranial nerve. Okay, let's look at this image so you can understand it very easily. Here the tongue is divided into three parts. Okay, the anterior 2/3, the posterior 1/3 along with the circumvallate papilla, and the posterior most part. So the anterior 2/3 is by the lingual nerve, which is a branch of 5th cranial nerve, that is the trigeminal nerve, only for the general sensation. Then comes the cauda tympani nerve, which is for the taste sensation in the anterior 2/3 part. Then comes the posterior 1/3 and the circumvallate papilla. So here general plus taste is by glossopharyngeal nerve, which is the 9th cranial nerve, and the posterior most part is the internal laryngeal nerve. Okay, internal laryngeal nerve, which is a branch of the 10th cranial nerve, that is the vagus nerve. Both the general and taste sensation. Okay, and here if we look at the motor supply, all the muscles of the tongue are supplied by hypoglossal nerve, that is both the intrinsic and extrinsic, except for the palatoglossus muscle, which is supplied by the vago-accessory complex. So this is a very important thing to note, that genioglossus muscle, which helps in the protrusion of the tongue, is also known as the safety muscle of the tongue. Why? Because if it gets paralyzed, the tongue will move back into the mouth, which will lead to the blockage of the air passage and difficulty in breathing. That's why genioglossus is very important. We have read ahead that genioglossus is supplied by the hypoglossal nerve, that is the 12th cranial nerve. So how to diagnose if there is an abnormality present in the tongue? See, let's look at this image over here. The tongue, when protruded, it deviates the tip. This is the tip. The tip deviates towards the left. So here we can conclude that the lesion is present on the left side of the hypoglossal nerve. That's why the tip is deviated towards the left, because there is an imbalance of genioglossus contraction present on the left side, but right side is the normal side. So the base of the tongue is present on the normal side, that is the right side. Okay, so here to conclude that the tip of the tongue is protruded towards the side of the lesion. Here the right side was paralyzed, so right side the tip of the tongue went, and the normal left genioglossus there is present, so the base is present at the left side and vice versa. Okay, so if you have any doubts regarding this topic, you can ask the doubt in the comment section below. Please subscribe to my channel and thank you very much.